the drivers for me for the book actually was my caregiving experience. And it became very clear very quickly that even having a medical background and then also having the extra experience and expertise as it relates to the system itself, it was still very much, quite frequently, a struggle and really needing to advocate strongly, persistently.
I thought I knew the healthcare system because I was a human resource executive. I was in charge of the health and welfare benefits for a large global company. And I thought, well, I really know how this works, but I didn't know it at all as a patient. I ended up having a brain tumor and I needed to find a surgeon quickly. I had to have it out because I had had a seizure. The book opens with my story, and while I'm retelling it, I'm actually tearing up, and because it's still very emotional about it. And it took a while for me to get through all that, for me to write it down.
The book is actually intended for anyone who is going to interface with the healthcare system, which generally means everybody, because sooner or later you will have to, unless you're way off the grid.
Navigating the healthcare system is very difficult. It really is about understanding how things work and speaking up and being your own advocate.
Health disparities are very prevalent in healthcare, and they have a cost in terms of quality of care, cost of care, and people's lives. Health disparities are differences in the way that people experience care delivery and the way that they are treated while they're in the system.
Healthcare is very expensive in this country. Compared to other countries, it is much more expensive. We have the highest per capita expenses, and one of the issues is that everybody doesn't have access to healthcare insurance, or they can't afford it.
The reason that people were willing to share these very personal, intimate stories with us was because they wanted a better experience and better outcomes for other patients. The key to getting a diagnosis, the key to getting the care that was needed, the key to getting to a better place at the end of the day was persistence, perseverance, self-advocacy, asking questions, not giving in, not giving up.
I felt like this is something that I can help others learn from it. And since this whole thing happened, people have come to me and said, how do I get my doctor to return my call? Or how do I can't get an appointment for 3 months? Or I'm not sure I think I'm paying too much for this. How do I question the doctor's bill? So people are coming to me to ask all kinds of questions. And so I felt like if I can just put this down in a book and make it easy to understand, hopefully it'll help someone through this.
It's an uphill battle, often not just for patients, but also for the physicians, the nurse practitioners, the PAs, the pharmacists, the staff, to do what they would really want to do and the reason that they went into the jobs that they're in. So I know with all that brain power, this is something that we can change and make much better. We just need to collectively have enough will to collectively move forward. And that comes back to the importance of recognizing the power that you have and exerting that power.